Hi, how are you today? I'm Christina. I'm your nurse. I'm here with a couple of discharge paperwork about your current medications. These are all printed out, and you can take these home in case you forget anything I said. Okay. I'm going to go over the medications that you're currently on, and then we'll go over the newer ones as well. All right. So the levothyroxine that you're on is also called Synthroid, another brand name, levothyroid. This is to treat your low thyroid levels. It works by replacing the thyroid hormone usually made by the body. All right. So thyroid hormones play an important part in your overall health. It helps your metabolism and your energy levels. You should always let your provider know about any conditions as far as like high blood pressure and your high blood sugars. This medication should be taken by mouth with plenty of water. It is best to take on an empty stomach 30 to an hour before breakfast. You're going to avoid antacids containing aluminum or magnesium and iron within 4 hours of taking the medication. All right. You're going to follow the directions on the prescription label. Take it at the same time each day. There's a couple of things that interact with the medication, such as antacids, calcium supplements, certain medications for depressions, iron supplements, liquid nutrition, such as like Ensures, medications for colds, medication for diabetes. So you should always let your providers know that you are on this medication. All right. Side effects that you're going to look for is allergic reactions like your skin rashes, your itching, your hives, swelling of the face, lips, tongue, anxiety, nervousness, heart rhythm changes, tremors, shaking, trouble sleeping. You want to let your provider know if you have any of these. Okay. And then side effects that usually don't require any medical attention is going to be like a change in appetite, hair loss, headaches, nausea, and vomiting. You will need regular exams and occasional blood work to check the response to the treatment. If you are receiving this treatment for underactive thyroid, it's going to take several weeks to kick in. So I'm not sure if you're, there yet. You're going to check with your care physician if nothing has improved. All right. This medication can affect your blood sugars. So you want to make sure that you check your blood sugars as directed. And if you're going for surgery, you're going to tell your care team that you are currently on this. All right. And another familiar one is your Protonix. It's also called pantoprazole. And this is to treat heartburn, stomach ulcers, reflux disease, or any other condition that cause too much acid in your stomach. It works by reducing the amount of acid in your stomach. All right. You're going to let your provider know if you have lupus, liver, again, just let your providers know anything that's just not of the norm. All right. You're going to take this medication by mouth. You're going to swallow the tablets whole. You're not going to crush, break, or chew, and you're going to take with water. All right. So you're going to take the medications at a regular intervals. What else? Side effects that you should always reach out to your provider. We're going to say your allergic reactions. Remember your skin, itching, hives, swelling of the face, decreased amount of urine, muscle pain or cramps, low vitamin B12, pain, tingling, or numbness in the hands or feet, weakness, severe diarrhea, fever, or unusual bruising and bleeding. Okay. It can take several days before your stomach pain gets better. Check with your care team if the condition does not get better. All right. And you're not going to treat diarrhea with over-the-counter products. Contact your care team if you have diarrhea that lasts more than 2 days. All right. Using this medication for a long time may weaken your bones. So you want to talk to your provider about bone health. All right. And then using this medication for a long time may also cause growths in the stomach. They usually don't cause any symptoms. They're usually not cancerous, but you're going to contact your team if you notice any pain, tenderness when you press on your stomach, have nausea or bloody or black tarry stool. And this medication can also decrease your vitamin B12. So make sure you get enough vitamin B12 and talk to your prescriber about medicines. All right, so we have a new one. Lisinopril is also called Zestril or Prinavil. So this medication is for high blood pressure. It is also used to prevent further damage to the heart after a heart attack. It works by relaxing your blood vessels, which decrease the amount of work the heart has to do. Okay. You're going to take this by mouth. Take it as directed on the prescription label. Same time every day. You can take it with or without food. If you do tend to get an upset stomach while taking it, just try taking it with food, and that should work with that. All right. This medication may interact with NSAIDs, which are like your ibuprofens and your naproxens. So just let your provider know before like treating yourself for any pain. Side effects that we are going to call our provider for is your skin rash, itching, hives, swelling to the face, eyes, lips, tongue, arms, legs, trouble breathing, okay? High potassium levels, if you have any muscle weakness, right upper belly pain for liver injury, and low blood pressure, dizziness, feeling faint, lightheadedness, or blurry vision, all right? Do not treat yourself for coughs, colds, or pain while you're using this medication without asking your healthcare provider advice. Some medications may cause increased blood pressure. All right. And you want to get out of bed slowly. And we're not going to use any machinery or drive or anything until we know how this medication affects us. Okay. Our next new one is low pressor, and it's also called metoprolol. This is to treat your high blood pressure as well. It also prevents chest pain. It works by lowering your blood pressure and heart rate, making it easier for your heart to pump blood to the rest of your body. All right. You're going to take this medication by mouth with water. Take it as directed, of course. You can take it with or without food. You should always take it at the same time. All right. And then you're going to give your healthcare provider a list of all the medicines, herbs, non-prescription drugs, or dietary supplements that you're on. All right. We're going to call the provider if we have an allergic reaction, if we have shortness of breath, swelling of the ankles, feet, hands, sudden weight gain, if we have low pressure with dizziness, the feeling faint or head, lightheadedness, if we have cool, numb, or painful fingers or toes that may change color from pale to blue to red, if we have a slow heartbeat, dizziness, feeling faint, and worsening mood or feeling depressed, okay? You're going to visit your care team for regular checks, okay? Check your blood pressure as directed as your care team for what your blood pressure should be so you have your normal range, all right? Do not treat yourself for cough, colds, or pain. And that's about it. Remember, get up slow. Don't get out of bed quickly because you can get dizzy. Our next one's going to be metformin. This is also called glucophage. This is to treat type 2 diabetes. It controls your blood sugar and it helps your body use insulin effectively. You have no insulin. So this is, this medication is often combined with changes to the diet and exercise. So we are going to have a lifestyle change as well. Take this medication by mouth with a glass of water. Follow the directions on the label as always. Take the medication with food. Take your medication at regular intervals. Do not take your medication more than directed. And do not stop taking the medication unless you've been told to. All right. If you miss a dose, you're going to take it as soon as you can. Now, certain contrast medications given before x-rays, CT scans, MRIs, or other procedures, you got to let your doctor know because they'll let you know, let them know you're on this. So they'll let you know whether to stop it or not. All right. This medication may also interact with certain medication for blood pressure, heart disease, irregular heartbeat. So again, always let your providers know the list of medications you're on. We're going to call the provider if we have any allergic reactions, high lactate acid levels, muscle pain or cramps, stomach pain, trouble breathing, general discomfort, low vitamin B12, pain, tingling, numbness in the hands. Other side effects that don't require medical attention: diarrhea, gas, headache, a little metallic taste in your mouth, and nausea. A test called the HbA1c will be monitored, right? So this is a simple blood test. It measures your blood sugar controlled over the last 2 to 3 months. You will receive this test every 3 to 6 months, okay? Always carry a quick source of sugar with you in case you have symptoms of a low blood sugar. Examples of this are hard candy, glucose tablets. Make sure that other people know that you can choke. God forbid, you need this. Tell your care team if you have high blood sugar. You might need to change the dose of your medications. If you are sick or exercising more than usual, you might need to change the dose of your medication. Do not skip meals. Ask your care team if you should avoid alcohol, okay? If you're going to need surgery, an MRI, a CT scan, or other procedures, tell your care team that you're taking the medication. You may need to stop taking the medication before the procedure, all right? You should wear a medical ID bracelet or chain and carry a card that describes your disease and details of your medication and dose and times, all right? Yeah, these are basically a pretty much summary of everything here. Like I said, these here are for you and you can take these home, and just good luck with everything.